Hi guys, so I just wanted to do a quick video for you today about my most frequently asked questions in the clinic, especially for microblading. First thing I get asked is what's the difference between microblading and permanent makeup or tattooing. It's all tattooing. The difference between microblading and other forms of permanent makeup is the tool that we use, which is going to be a manual blade. We call it a blade, but it's not. It's actually pins standing straight up. They come in different sizes and different types. I'll see if I can show you a blade up close. That's it there. And we put that in a manual holder, which is disposable. We dip that into the pigment and then we take it through the brow. And that creates really beautiful fine hair strokes. I'd normally choose microblading for most people as you get a really beautiful result with it. The only time I would choose another option like machine is if you're terribly oily across the T-zone, or if your skin's very, very thin, or if you're just not accepting pigment well, then we can use machine afterwards. The biggest question I get asked is, does it hurt? It's absolutely fine. It's a little scratchy the first pass. I'd say about 80% of my clients fall asleep or are close to sleep at some point. They're really, really comfortable. And if at any point it starts to get scratchy or stingy, let me know and I put more anaesthetic on. I have a really low pain threshold, so I use lots of anaesthetic anyway. But you should be really, really comfortable. The other questions is like, will it be really dark afterwards? Will I look terrible? No. Most of my before and after photos are taken directly after the treatment. So you may experience a little redness around the brow. Otherwise, no. It's a little darker for a few days, but nothing like the sort of scary stuff I see, unless we're doing a lot of shading, which is unusual because most people just do microblading and a little bit of gentle shading. Will it scab? You may see some light flaking. I don't have clumps of skin falling off. I give you very strict aftercare instructions which I want you to follow, and that will prevent a lot of the scabbing that you may have seen otherwise. I often combine multiple treatments when I do a brow, so I may do microblading and also a little bit of shading underneath. When you come for a consultation or when I see you, we will decide the best options for you. Sometimes once we've done the microblading, that's absolutely enough to go on. How long will it last? Microblading will last somewhere around a year. I see most of my clients between 10 and 14 months for their touch-up, and that's just a single session, which is half the price of a normal session, and then away you go. Can anybody not have microblading? Yes, there are some prescriptions, some medications, and some skin conditions. If you're immune compromised, if you're going through chemo, or if you're on blood thinners or have very, very high blood pressure, then we may not be able to treat. Pregnancy and breastfeeding, absolute no, I'm afraid, until you've finished. With respects to cancer treatments or chemotherapy treatments after the chemotherapy, if you can get to us before your first cycle starts, then we can certainly treat, and that way you've got a base for the brows should you start to lose your brow hair. Another option is we may be able to see you in between your chemotherapy and your radiotherapy, so you're covered for that period. Otherwise, it will be after those cycles have finished. Those are all the questions that I get asked most of the time. Please feel free to ask questions below if there's anything I've forgotten or anything you want to know. And we hope to see you in the clinic soon.